Everyone's coming in.
Hi, everybody.
Hi. Hi.
How are you doing?
Hey, good. Nice
Good.
to see you. Thanks for coming on. I'm almost there. I'll give it a minute. We'll do 5:01. Oh, good. Hi, Beverly. Hi, everyone.
Mary should, okay, Mary's looking fabulous. That's great. Wendy, should I mute myself?
Can you what, see?
Should I mute myself now or not?
No. We're like in a minute. I'm going to give everybody exactly 1 minute.
Hi, Wendy.
Erin, can I see you, Erin? I don't see you. I hear you. I want to see you.
Can you see me? You can see Erin, right? You can see me.
No, I can't. Pat, can you see Erin?
I can see Erin.
Oh, there you go. Hi.
Yeah. Hello.
Hi.
Hi.
Very nice. Okay, good. People are coming in. Nice.
Are you seeing, is this up too high? Do I need to get this?
Oh, you look
Oh,
fabulous.
it's perfect.
Perfect.
Okay, great. Thank you.
Okay. So I think we can relax the music a little, and we're gonna get started. Great. Well, hi everyone. Happy March, and welcome to episode 3 of Generational Dermatology GDermFresh. I'm Dr. Wendy Roberts. I'm founder of Generational Dermatology. And what we do with Generational Dermatology, we address the needs of the evolving aging patient. So in practice, it's not waiting to treat something tomorrow that you can anticipate and prevent today. So let's take an example on filler, right? The best way to address face jowls is knowing how the jowls arise and treating that causation, those anatomy shifts while the patient is evolving. And that's what it's all about. I practice in Palm Springs, and that's where our annual meeting is live. It's every President's Day weekend, but of course, not this one, thanks to that 5-letter word, COVID. But in response to COVID, we're doing these monthly live Zoom episodes through the first Tuesday of every month through December. The silver lining of this whole thing is that we're building a terrific community, people that have come on, and I'm seeing you come in today, and we've even connected beyond those monthly Zoom meetings, and that's really great. So please check us out. Go to our website, Generational Dermatology, where you can see highlights of past episodes, connect with presenters and industry sponsors, and even order our GDermFresh box. Da-da-da-da. This is a great box. This box is always packed with the latest in specialty products and desirables. And the good part is it arrives straight to your door. So think of this as a delivery of an exhibit hall in a box. And just like our exhibit hall treasures, if you're not interested in the products, someone in your home is. So you can go online and order the box. What's better than one box? 2 boxes. And Dr. Shamban has launched her signature box by Dr. Ava, and it is really sensational. So I encourage everybody to go and get that box. That information will also be on our website. Some housekeeping items. We'll be taking lots of questions all through the Zoom. At the end of everybody's talk, we're going to do questions. So I encourage you to please write any questions in the chat box. It's no holds barred. You can question us anything, and I promise we will answer it. I can't believe that it's been 1 year anniversary of COVID in our daily lives, right? Everything changed March 2020. So I just wanted to ask each faculty member, first of all, I have to say thank you to all of you. You guys are truly all-stars. We're so blessed and fortunate to have you on tonight. And I just can't wait to hear what everybody says. So in a kind of a brief sentence, if you faculty wouldn't mind answering the question, what was your biggest practice lesson from COVID? And anyone can answer.
I will wear a mask forever.
I love it. Ever and ever. Love it.
Well, I mean, Mary, we're like taking lessons from the Asian continent, aren't we? That everyone's been wearing masks forever. My son said that too. He goes to college and he was saying we would be. In my practice, it's really been about, I think, patients kind of balancing out their cosmetic needs with their need to sort of be with their families and kind of deciding, is this something I need to do or not do? If there's a risk. And then in terms of my own practice, just my own philosophy, it really also has been about keeping my staff and myself safe and my patients safe. So it's completely, something we've never had to deal with this before. So we've never had to think in this manner before. So that's what I would say.
Right, totally.
I think that, yeah, we had a couple of rough months there, but I was really thankful that I had built a staff that was loyal and hardworking and ready to help me pull it through. So it really brought us even closer together and made us very appreciative for what we were able to accomplish and the team that we were able to build.
That's awesome. Was there like one, pearl or lesson that you came out of it with?
Be prepared with technology at all times. Because that was the one thing that we were able to continue to do flawlessly was communicate with patients. And also our online store, our e-commerce was set up from the beginning to be autonomous. And we really had to focus on addressing patients that way. And, that was a nice financial crutch as well.
Right. So a revenue stream. Ava or Mike, are you on yet? Anyone? Not yet. Okay. Corey, it's interesting. Mine kind of two things. One, I really learned to appreciate my various revenue streams because, when one door closed, I had, another door is open. So I really, especially the telehealth revenue stream, that I think is huge. And we need to invest in our telehealth health of our practices. So that was a big one for me. I just felt so grateful for every different revenue stream, right? And the other one is a little bit funnier, but I think that whatever you call it, the reception room or lobby or waiting room, I think it's highly overrated because I mean, I just got more efficient with nobody in my reception.
True. It's true.
Yeah.
Yeah, I've heard several physician friends across specialties say that the waiting room's never coming back.
Never coming back. Never coming back. So, well, thank you guys. It's really great, interesting. Hey, Val, I saw you. Eva, hey, thanks for coming on. Before we start, I want to thank Underskin, who's our sponsor for this evening. And they've been very generous and we're going to hear more about them later. But thank you, you guys. I love your products. And thank you so much for supporting generational dermatology. We're going to meet our GDerm All-Stars, and we're going to start with our first one. And I love we're starting with her. And I'm going to introduce Dr. Lupo. Okay, so I've got a slide for you. Mary. Dr. Mary Lupo is a board-certified dermatologist. She's clinical professor of dermatology at Tulane University School of Medicine, internationally recognized in non-surgical skin rejuvenation. Dr. Lupo has pioneered the concept of combination therapies, resurfacing, filler injection, neuromodulators. She's a real guru, and we all have learned so much from her. Dr. Lupo is past president of the Women's Dermatologic Society, and she's co-founder of Cosmetic Boot Camp with Dr. Ken Beer and Dr. Vic Narkart in memoriam. Thank you so much Mary for coming, and you're going to tell us all today about something I know you love, and I'll let you do the rest.
Okay, well, Wendy, thank you for including me in this group. And I love your format, and the virtual format does open your meeting up to people that don't have the time or the means to get away from their family and attend these meetings. So congratulations. The Cosmetic Boot Camp will be live in Aspen this year. So what I'd like to do is discuss something that's very near and dear to my heart. Those of you who've attended a boot camp know that I get up and I correct anyone who uses the word diluting, because I think diluting is not the appropriate term for what we do. So what is hyperblending? Why would we need it? When would we do it? And how do we do it? So let's go through sort of my thought process. So hyperblending is the dilution of filler when added sterile saline, water, or lidocaine is added to a product beyond what is recommended, and it's very off-label. It's the terminology that should routinely be used by you and your staff, talking to each other and talking to patients, because the term dilution is misconstrued. It prevents the patient from feeling that they're getting less of something when in fact, they're actually getting much more sophisticated and personalized product choices. So why would you hyperblend? Well, it will make one syringe go further and be able to use in more than one area. It thins out the viscosity in order to use it in an area of very thin skin without bulking it up, causing blebbing or ridging. It also will superhydrate a hyaluronic acid filler, which can decrease post-injection swelling. And this is particularly important in the periorbital area. So I always use hyperblended product around the eyes when I'm injecting superficially, not on the bone, but superficially with a cannula in the temple and in all of my off-face injections. When do you need it? Well, anytime you're way off the FDA indication grid and or perhaps in an off-label territory where you don't want to get nodules.
Mayor, I'm gonna interrupt because this reminds me of Prague, Mary. We're just all listening to you so intently, but we're gonna look at your slides.
Can you click your share screen again, Dr. Lupo?
Oh, I did that. Okay, so I think.
Yeah, but it didn't matter, Mary, because we're all just listening to you, everything you're saying, holding on to every word.
Okay, so let me go back and I'll do that again.
No, you do that. And I see Dr. Michael Gold is in the room.
Okay, I think you kicked me off, Wendy, when you introduced me. But anyway, do you see my slide?
No, not even.
Perfect. You're all good. You're good to go now.
Okay, great. Okay. So besides patients on a budget, where you may want to introduce filler in multiple areas with just one syringe, but you're also able, because this is an advanced technique, and I encourage everyone to charge for the procedure and the technique and not necessarily by the syringe, if you will, you can actually increase the profit margin, because I think you should charge more for more sophisticated and advanced treatments. Okay, so now it's not progressing. There we go.
Oh, here we go.
This is an example of a patient over a 7-year period. Between 2011 and 2014, she was consistently in my office approximately every 4 to 8 months. She never received more than one syringe in any one sitting. When she first came in February of 2011, I absolutely felt I needed to concentrate in her temporal hollowing. And so I used hyperblended Radiesse in this area. But over the years, she got both hyperblended Radiesse as well as some hyperblended hyaluronic acid. Then from 2014 to 2018, she was lost to follow-up, and she still maintained that degree of improvement. And that's why I put those side by side. So the point of that talk, of that slide, is that you can take one syringe, and if you do consistent injections, you can build on your progress. This is another young woman who had very naturally high cheekbones, but she had that steep drop off in her temple area and in the jowl area. And this is the evolution of her treatment over several years, never more than one syringe. She received hyperblended Juvederm. Now, this is a classic example. I'm a huge fan of what I call hyperblended Belotero in the periorbital area. And this kind of shows you, I always like to inject that lateral tear trough, much more so than the medial tear trough. You really do need to thin that material out. Men are also very good candidates for this procedure. It gets that semicircular sleep line that's sort of perpendicular to the dynamic lines, and it fills in the sulcus and it softens the entire area. And this was with hyperblended Belotero. Here's a series of injections of the patient. She never received more than a total of 1 cc, and she would just come in very periodically. In the periorbital area with hyperblended Belotero, it is my experience that one syringe will last you about a year in most patients. This is a long-term result. This shows you that when you do the more superficial, this is not injected on the bone. This is injected sort of submuscular. But what it does is it conceals some of the blood vessels that are around the eyes, much as the same way when I show hands, you'll see improvement of the vascularity of the hands when you conceal it with filler. Now, the jawline is another area where I absolutely love hyperblended Radiesse. And this is a very old slide. I started hyperblending Radiesse in 2007. And I first started it on the hands, and then I moved to the face. And I tell people I sort of turn Radiesse into Sculptra in some ways. And I always inject it with a cannula in a fanning fashion. I inject at the point just lateral and superior to that jowl. And I inject along the jawline. And then, I don't know if those of you who follow me on Instagram, in March or April during the quarantine when I couldn't practice, I actually did what I call the Sculptra 2-stick in my bathroom, and I posted it on Instagram, showing my technique of how I inject. And in this area, I use just about anything, but I particularly like hyperblended Radiesse in this area. And you can see it gives an expansion of the lateral portion of the jawline, and that actually gives the illusion that the jaw is less prominent. I am now combining this technique with about anywhere from 0.6 cc's to 1 cc of Kybella in that jowl fat pocket and getting even better results. And I think I have one of those I'm going to show you. Again, this is another old case showing hyperblended Radiesse when I first started to do this. This is a long-term result, hyperblended Radiesse, once or twice a year, never more than a total of 1 syringe. I love the fact that I have a very diverse patient population. The recession of the chin ages the face terribly and gives a resting, sad face. And putting, this is 1 syringe of hyperblended Radiesse in a fanning technique. And, you know, I think she did it twice in this 2-year period, this 3-year, 4-year period. So there's a lot of duration from this technique. Here's another example to sort of better define the jawline and to give a sort of like that sculpted snap underneath the jawline to prevent, as what Ava calls the jeck, which is when the jaw and the neck combine. Just another example of a hyperblended Radiesse. Now, this is an example of a patient where I actually did hyperblended Juvederm. And this is in the between the cleavage. She was a side sleeper. And this shows the progress. Over this period of time, she never received more than a total of 3 syringes that were hyperblended 1-to-1. Another example of these chest lines, this was not done with laser. This was strictly done with hyperblended hyaluronic acid. Now, I've been doing the hands for a long time. Radiesse is my absolute favorite for this. And this is an example of, in this particular case, this was a younger patient, and she received 1/2 of the hyperblended vial to each hand. So this was done with only 1 syringe of Radiesse. And what blew me away is when MERS did the clinical trial, they were using 4 cc's, and it just, I never understood the methodology there. I thought that my off-label, and always with a cannula, so there's virtually no bruising, no risk of vascular event, etc. And this is a 1/2 of a syringe, and this is from August to her follow-up in February, and this was the duration, and you can see how much better the skeletal look between the tendons is. Another example, 1/2 of a syringe, hyperblended. Another 1/2 of a syringe, hyperblended, and I had her come in about 3 weeks. They do stay puffy like that for anywhere from 1 to 3 or 4 weeks. Just another example, hyperblended Radiesse in the hands are like, what is that expression? Peas and carrots, they go together well. Now notice that it diminishes the appearance of the blood vessels in this area. And this is approximately 3 months after 1/2 of a syringe of hyperblended Radiesse. Now, another off-face area that I particularly am fond of is the knee area. And this is the course. This between September and February, she had received 1 vial to that area. It was hyperblended to about 16 cc's. And then you see continued improvement with an additional vial. So only a total of 2 vials between September of 18 and February of 20. And this is her other leg showing that kind of progress. So, and this is, you know, I'm not quite sure why her leg looks thinner. It's probably my angle is a little bit different, but you can see above the knee, all of those wrinkles are improved. And please note that the dimpling, dimples, we need to be careful now that Quo is coming out. I did the FDA, I was a principal investigator on Quo. And what I want to caution everybody is they need to be careful that they do not confuse laxity with cellulite. And it's important to know what you're treating when you get the Quo. Now, there's many ways that you can ask me questions. I am happy to answer any questions tonight. I respond to direct messaging through Instagram. I'm very good about that. I wanted to make sure that's why I only talked for about 12 minutes. I have 15, so that if you want me to address some questions now, I'm happy to, and then of course I'll stick around. Thank you for your attention.
Mary, that was amazing. We do have some questions. One question is, how do you know how much solution to blend with each filler?
Well, you know, we're in off-label territory here, and, you know, I'm a cook and I'm not a baker. And the reason I'm a cook is because I never do anything exactly the same. If you ask me for a recipe, I'm going to give you a very broad strokes about how I do it, but I really don't do it exactly the same every time. So I do change it up. A typical, and I don't bake because I can't stand the precision of baking. Do not tell me I have to have this much of anything. So the way that I would say that I do it is typically, or always with the hands, with Radiesse, I am using the 1.5 syringe, And I am mixing it in 2 5cc syringes. And I add 0.5, and I use lidocaine with epinephrine. And then I use 1 cc of sterile saline. So my so it's 1.5 of the product, 0.5 of the lidocaine with epinephrine, and 1 cc of sterile saline. And I blend that together. You've got to blend it so that it's so smooth. And I inject it with a 25 gauge 2-inch cannula. That's probably the only thing I do consistently. Now, when I'm on the face, there's a lot of variability. Does the patient have a lot of atrophic changes to their skin? In which case I might hyperblend it a little bit more so you don't get any ridging, because I do a fanning technique. If they have thicker, more, sort of like that hypertrophic, actinic changes to the skin with a lot of rhytids, I might have it be a little bit less concentrated. Typically, when I do the Sculptra on the knee area, I'm typically doing about 16 cc's of sterile water, and then a cc of lidocaine. And I use epinephrine. I use lidocaine with epinephrine because it cuts down on bruising. And I'm not worried about a vascular event here. And then with Belotero around the eyes, it's typically 1 cc to 0.5. But if the person is very thin skin, I will do a 1-to-1 with the Belotero and a little bit of Lido with epi, and then sterile saline. And then when I do the chest with or the neck with hyperblended hyaluronic acid, it's typically a 1-to-1, and I use sterile saline.
Amazing. That was great. And we have tons of questions, all pretty much the same thing. So Sharice, Leah, Anna, I hope everybody got their questions answered. You talked about the hands and that dilution. I think we're all gonna either have to take a bus to New Orleans or up to Aspen to boot camp to learn that hyper blending. Awesome talk. Thank you so much, Mary.
Right. And just DM me, I'm happy to answer.
Great. That's fabulous. Okay. Our next speaker hails to us from Alabama. And I'll take his intro slide. Dr. Corey Hartman is a specialist. He's a board certified dermatologist, graduated from Meharry Medical College, and he does it all. He does skin rejuvenation, anti-aging patients, and really very keen about making cosmetic treatments accessible and maintainable. So Corey, we're so happy to have you here today, and you're going to talk to us about signs of youth and injectables. Welcome.
Thanks, Wendy. Let's see. Let me get my slides going, and then I will...
While you're doing that, I see a few GDerm All-Stars have come in. Val Callender, Eva Simmons O'Brien, Diane Orlinsky, Nancy Anderson, Ava Shamban, who we're going to hear a lot from later. It's nice to see you guys. We know you're in.
Oh my goodness. Okay, let's see.
Hey, Diane Burson. Hi, Di. Another GDerm All-Star. Great. Thank you so much for coming on. I'm so excited, Mary, about this hyper blending. Hold on, I can't hear you. Unmute. Unmute yourself.
I said, you saw me do this at boot camp in 2007 in the
I
hand.
know, but it just gets better and better.
Oh, yeah.
It's like fine wine. You're maturing, and it's just getting better and better. Still excites me, Mary.
I don't understand why this won't share.
Okay, Pat, how are you doing, Pat?
Dr. Hartman, the bottom of your screen, does it say share screen?
It says share screen right in the middle, but it wants me to do a whole security thing that it won't let me bypass. Let me try it one more time. Zoom, here we go. Okay, I'm gonna be right back.
Okay, you know what, Corey, if you wanna work on that, why don't you just work on that so you have no rush, and we'll just kind of move along here. All right, because she's in the house, Dr. Erin Gilbert.
Yes, I am.
I have a little slide for you first, though, dear.
Okay.
There's your 5-star slide. Dr. Erin Gilbert is an internationally known board-certified dermatologist. She's the founder director of Gilbert Dermatology in New York. She holds a combined MD, PhD degree from SUNY Downstate. She performed internship at NYU Medical Center and was chief resident at SUNY Downstate. Now, here's a fun fact. She is president-elect probably any day, Erin, correct?
Yep, it's April 1st.
April 1st, she's president-elect of the Women's Dermatologic Society. And a fun fact is, you guys actually have 3 WDS presidents on this call. I mean, imagine that. Dr. Lupo is also a past president of the Women's Dermatologic Society, and I'm a past president of what we love to call the WDS. So 3 of us on a call. Erin, I can't wait to hear about your talk. When you first told me about it, I was so curious. You're going to speak to us today about botulinum toxin for rosacea.
Okay,
Welcome.
great. So what I'm going to do now is I'm just going to go in here and I'm going to start my screen sharing. Okay, so here we go. So we'll play. And that actually, unfortunately, got me out of where I'm in Zoom. So share screen. And now I am, you would think with all this tech prep that we actually would have had this going. Here we go.
Oh,
Perfect.
Oh,
Okay.
oh, I love this.
Can I see this now?
Yeah, it's beautiful.
Okay. So some of you may have heard me talk about this topic before. When I've sort of started thinking about it, and when my first patients came to me, they were really coming in really with kind of a medical concern. And I was thinking about it because I'm a nerd and a scientist, hence my glasses. I was really thinking of it as a way to help them medically. And when I thought about this presentation in the context of this meeting, what it really brought me to was some conversations that I had with my patients. I've got quite a few now who I've been treating, some for 4 years on a regular basis. And it brought me to some of the conversations I've had with them. And it really made me think about how does this enrich their lives? And it's not only from a medical perspective in that they have reduced flushing, but when we think about what that actually does for them, is it also provides them with confidence. It also does other things to their skin quality, which I'm going to talk to you about. So I thought that there was also sort of a cosmetic and overall life benefit component. So I'm going to bring that into this go rounds talk. Okay. So botulinum toxin for rosacea. So we know it's been talked about for years. It does relieve flushing. But I've really been thinking about it also in terms of improving skin quality and increasing self-esteem. Quick disclosures because we do that. So when we think about common rosacea therapies, we know that we have our oral therapies, we have our antibiotics, beta blockers, clonidine. We have our topical therapies, including our antibiotics, azelaic acid, metronidazole, ivermectin, the sulfurs, brimonidine, oxymetazoline. We also think about laser treatments, and we think about cosmeceuticals. And we really also kind of want to think about, like, what is the mechanism by which botulinum toxin might work? And this is something that I wish were further along. It really isn't quite there yet, but I'm just going to sort of talk about a few fancy science words, but they've been being researched for quite some time. As you'll see, the references go back to 2011. So they're actually really relevant. So what we know is that there are multiple potential therapeutic targets for botulinum type A neurotoxin. And one are neuropeptide genes. And we know that neuropeptide genes are upregulated in rosacea patients. So this would be one like vasoactive intestinal peptide. Also pro-inflammatory, non-neuronal, transient receptor potential peptide also is upregulated. And there are two specific cases. You have erythematotolangictatic rosacea and papulopustular. There are two different sort of profiles of what are called these TRPV receptors expressions in these forms of rosacea. Now, sebaceous gland overactivity is actually reduced by botulinum neurotoxin. And we kind of know that just by observing things clinically in a cosmetic context. We also know that botulinum toxin reduces vasodilatory responses. And also just kind of bringing it all back together, it influences CGRP, which is calcitonin gene-related peptide, vasoactive intestinal peptides, substance P, and cholinergic mechanisms. So recently there actually was, this was sort of one of the newer papers I found, and I found it quite interesting. It was a study looking in vitro and in vivo, looking at the role of mast cell degranulation in human and in murine cells. And also in murine skin. And what they found is that pre-treatment with onabotulinum toxin type A or B significantly reduced mast cell degranulation in both human and murine cells and rosacea-like erythema in murine skin. So again, another, we could imagine how this might play a role in rosacea flushing. So there clearly are multiple factors that are involved. And I think that, the truth is, in my patient population, I've thought about it, and until we get a whole bunch of people who are ready to do a split face and be biopsied and sort of stop treatment and then be biopsied in one side and then the other, and then have staining done, it's going to be very hard to like really definitively show exactly what's going on. So we remain a little bit in the dark. So just my dosing and techniques real briefly. So what I want to first do is I map out my treatment area. So I take my patient, I look at them, I kind of go over with them what areas bother them the most, where they're flushing the most. The nose, the cheeks, the forehead, the ears can be treated. Ears are actually a common place for flushing. And I dilute all my toxins the same. So I'll talk about Botox or Dysport, but generally what I'm using, I'll say, is 1 to 2 Botox units in intradermal blebs, 1 centimeter apart. And what I'm seeing is usually onset in 7 to 14 days. And maximum effect in about 3 or 8 weeks after the treatment. And I'm finding that duration is anywhere from 4 to 6 months. Some patients don't want to wait that long. They just don't want their flushing to come back. So they'll come in sooner. So some actually come in every 2 or 3 months. So this is, Steve Diane was one of the first people to kind of look at using botulinum neurotoxin for flushing and rosacea. So this is one of the images. So what he showed here was a reduction. Even you can clearly see there's a reduction in erythema. There's reduction in oil production, decreased inflammatory lesions, reduced flushing, and pore size is minimized. Here are 2 other case reports, one by Steve Diane, again on the left, where he injected 10 units of Botox, and then on the right by Park et al., and they used 50 units of Botox. So a little more detail about my approach. You're going to get to see what my graphic designer calls my pokey slides. So when I generally use Disport, I tend to like Disport a lot. So what I'm doing here with her is she came in, the original photo of her is on the left. This is a patient I've seen for 4 years. When she came to me, I'm just gonna share with you at this point, she and I talk a lot. She said that she actually wanted to commit suicide. She had nothing, and this came out of the blue. And she said she wanted to commit suicide because she was not able to work. She was basically, at home with ice packs on her face, with her windows open in the winter, with a fan blowing on her face. She couldn't lie down to sleep because then she would flush. So she was really suffering. So here what I did is, this is basically what I do. There's one paper that talked about cheek drop. I haven't experienced that. I tend to be pretty careful, but as you can see in the picture, even going as low as I've gone, I haven't had any problems with that thus far, so knock on wood. So what I'm doing here is intradermal micro droplets. Here, 3 to 6 units of Dysport per injection site. I use those very small syringes, so those very small insulin syringes. And again, my dosing range actually is pretty high. So I remember Susan Winkle asked me if she was blown away and kind of like, why are you using so much product? It's because this is what I have found works. I have gone lower and it hasn't lasted as long, and people haven't had good results. The results have been better with high doses. I've also had no complications. And as we know, this range of dosing is used for other things, in medical applications. So it doesn't worry me. So again, for her, it's repeated every 2 to 3 months. Okay, let's just get to the end here. Microdroplet treatment with botulinum toxin type A. You get a gradual yet consistent improvement in skin quality, pore size, facial erythema and irritation. So that went down for her. And the best reward is it significantly boosts patients' self-esteem. So this patient's treatment intervals have actually increased from 2 to 3 months. Now she's at 4 to 6. And I was speaking with her probably about 2 weeks ago, and she reports to me now that she's actually able to control a lot of her flushing just by letting her anxiety over it pass. So there's a tremendous mental component to it. It's like being in a vicious cycle. And when you're in it, it's really hellish for these people. So what I wanted to do as my final slide is I just want to show you her photos. So baseline, February 2016, she's being injected after 1 treatment. After 6 treatments, you can kind of start to see that erythema is fading. You're starting to see the improvement in her skin quality. And then 4 years later, when I saw this picture, I was blown away. This is the woman who used to know herself in this way. She used to wear makeup and, went into her office, and she sent me this picture, and I was just so happy for her and so happy to be part of her journey. And so I just wanted to share this with you. It's something that really will help with the symptoms, and it will also help with how people feel about themselves. So you can really make a difference in their lives. I'm going to skip this. I think that I've already said what I need to say. I mean, basically, it's safe, it's effective. We need more studies. Sometimes combination therapy can be good. So you might think about like XLV laser plus botulinum toxin or another laser, but you got to be careful that you don't heat them up too much. Because if you heat somebody up with flushing, they actually get very swollen and it can be a very negative experience for them. So you don't want to heat them up too high. Okay, references, and thank you always towards better things.
Thank you. That was wonderful. Thank you so much, Erin. What a great talk. So informative. We've got a lot of questions.
Okay.
You answered one, monotherapy, or can you do combination therapy with it? You addressed that. You said you could do combination. Anesthetic, the question came in, do you use anesthetic or no? A topical anesthetic.
What I find is that these people generally, their skin is so sensitive that if you try to put any kind of EMLA or anything on them beforehand, or Pliaglis or whatever, it's actually worse for them. So they basically are just like, this is rocking and I know it's going to help me. So they're like, go. Even for the nose and the ears.
Right.
So,
okay. Ears.
Yeah, so that's fine. One quick thing I would say about the laser and the treatment is you do want to space the treatment. So the basic concept you want to have is you don't want to cook your toxin, obviously. So you just want to give your toxin enough time to, we know this happens, technically quite quickly in terms of like real time frame. But what I would do is I would probably give someone at least 2 weeks in between treatments.
Okay, just two other questions that came. Oh, they're coming in. Dr. Gilbert, you're gonna have to stay on after. Yeah, I know you're in New York, but we're not letting you off. You gotta answer questions. Acne, how did acne do in your rosacea?
Honestly, I'm kind of known as the flushing person. That's kind of like people read about me in terms of like, online, they read about me in terms of being the flushing rosacea person. So that's really what they come to me for. So I have not had as much experience with acne, so I can't really answer.
Okay. Oh, okay. But someone on this Zoom that does, Dr. Eva Simmons O'Brien, you've been using.
I know that it helps. I know that it helps, but
she said she loves it. Do you want to speak or you want me to share your comment?
Oh no, I would love to hear what she has to say.
Eva, are you there or you want me to, I'll just read what you wrote. She says, love this. I've been using Microtox Dysport for cystic acne vulgaris.
Oh, yeah. And I know there are some papers that show that it actually does wonders as well. I just, I personally haven't done it. So, but that's great. Yeah. Fantastic.
Okay. Well, lots of questions. Don't go anywhere.
Okay.
We have to have you back. Okay. All right. Thank you so much.
You're welcome.
All right. Dr. Hartman, you're going to speak to us about kinds of use and injections. No, I'm not going to reintroduce you, but you're fabulous.
All right.
Hey, no apologies.
So Wendy, I want to thank you so much. I am on this call with people that I've learned from and admired for years. So thank you for including me. This all started after a Instagram post that I did where it was a reel where we just sort of highlighted some of the facial effects and facial characteristics that really lend themselves to a more youthful look, things that people might take for granted, like its strong anterior hairline and, an oval shaped face that has volume and contrast from different areas where the light and shadow bounce around. There are high prominent cheekbones that sort of set the stage and really frame the face in a way that holds everything else up. Thick eyebrows, consistently thick eyebrows through and through, which fortunately is back in style. I look at some of my friends, we were in that time period where in high school and college, the thin eyebrows were the rage and some of them have plucked them to nothing. So I'm happy to see that trend is over. A firm neckline, clear, smooth skin, obviously. There are studies that even show that patients who have pigmentation problems are more bothered by it than wrinkles. So we know that clear, smooth complexion is the foundation for all youth. And then a fuller lip that holds its shape over time. So we know that youth is universal. There are some ethnic variations that, you know, highlight each racial group and features that are more characteristic that really make that group stand out and look more beautiful. But signs of youth really do hold up across cultures, races, and all ethnic standards of beauty. So how does the face age with time? Well, we start to see bone loss and migration, obviously retraction of the jawline. And I describe it to patients as the hanger is holding up the garment, but it's not doing a very good job. We also see hollowness around the eyes from orbital bone loss and then a widening of the eye sockets. Patients have been coming in more and more complaining about looking tired around their eyes as we've all been wearing masks for the last year and participating in a lot of Zoom calls. So this puts the focus on the upper face, where patients tend to really show if they are living a healthy life, getting enough exercise and getting enough sleep at night. And then of course the muscles lose their strength, vitality, and elasticity, which contributes to facial sagging, droopiness in the upper brow, and then the dreaded turkey neck. And then we have redistribution of fat pads, where everything starts to go square instead of being more top heavy with an oval shape. And skin laxity also contributes to this, which is, of course, accelerated by photo damage and exposure to UV light. So I just thought I would go through a few of my favorite patients through the years and kind of show how we have been able to restore some of those youthful signs of aging for them through a conservative approach to neurotoxins, fillers, and lasers. I do practice in Birmingham, Alabama. The trend around here has not changed so much. We are a conservative state, and we like to respect the fact that patients are not so keen on walking around and really advertising the fact that they have gotten a lot of work done. So we try to keep it really, really simple. And that's why it's best to develop relationships over time with patients, which is what I like to do. I like Dr. Lupo's approach, about a little at a time, and use some hyperdilution as well. But I think that just planning, having a good relationship with the patient and kind of developing a comprehensive plan is also a way to go. It helps them with budget. It helps them with a downtime. This is a patient who had a big event that she was planning for in about a year, didn't quite have the budget, and we were able to really work with her to get her a look that she was pleased with over time by just gradually adding some filler. We use mostly hyaluronic acid filler, very little in the tear trough. Most of it is in the temple and the upper cheeks, which gave her good lift. And then we did do some periosteal injections on the jawline and in the jowls to help smooth that out, as well as some neurotoxin in the upper and in the lower face to stop the contraction of DAO, and then one Fraxel treatment to just even out her skin tone a bit. But she came back and was happy as a peach and had no makeup on, and that's always a good sign for me. This next patient is a yoga instructor who was looking in the mirror and not happy with what she saw, but didn't want anything dramatic, didn't really want anyone to be able to tell that she was having anything done. I know that the trend today would probably be to go straight for the tear troughs and to improve that, but that was actually the area that we didn't put any filler. She had a liquid facelift, which included Sculptra over 3 injection periods, the typical dosing schedule. And we focused mainly on her upper face to provide structure and restore her volume there, which lifted everything. She's a slim-faced, very active person, and was having trouble just maintaining the turgor and texture of her skin, as well as a facial volume that would allow her to look her stated years or younger. Whenever I approach the male face, we do it with caution. Again, this is the very deep South. And although the tide is turning and men are being more open about having injections and work done in this area, it's still not something that is widely discussed. I have a lot of men patients who actually come in with their wives, and that's a nice sort of way to introduce them to the practice. And it's always nice when you have the wife's buy-in. As long as it's a conversation that everybody's having, it seems to help with any stigma that may still be associated with having any injections performed. The lasers for hair removal and resurfacing aren't, it seems to me, a big a deal as injections can be for some men. So, and I always like to make sure that we get a good idea of what his goals are. We never want to over feminize the face. We don't want to make him look perfect. That's not really his goal either. He had some career concerns and also is just a very active guy who wanted to look on the outside the way that he felt on the inside. So slow improvements. He probably needed a lower eyelid blepharoplasty, but was not interested in surgery like that. I have a lot of patients who are in the position for who probably need a bleph and will need one at some point, but they just aren't ready for whatever reason. And we can do some a fair amount of masking and improvement with just the use of injectables. And he was very pleased to have avoided surgery and still gotten a rejuvenated look. And this was over the course of about a year as well. This is one of my favorite patients because she came in with a very specific concern that ended up not really being what she needed. Like most patients who have been marketed to about filler or who are sort of just getting into the bandwagon of thinking about it, they often think that they need, this happens a lot in African American patients as well, just because of the way that our skin ages and it tends to be thicker. We don't have the sagging, but we have that mid-face volume loss. And the nasolabial folds are a concern. But we actually did not focus on her nasolabial folds at all because we quickly identified that she had volume loss in the upper face, in the temple area, and then in the cheek and the tear trough. So that was the only area that got any filler here. But it looks like her nasolabial folds were treated as well, just because there was so much lift that we were able to achieve using Restylane Lift. And then this is a physician patient as well who had some concerns about the lower face. So angular jawline and strong profile were two of the aspects of a youthful face. And otherwise, her skin is in pretty good shape. Her cheekbones are sitting up high. We have some pigment to work on. But the lines in her neck and the fullness in her jawline and the lack of angularity and sharpness really bothered her. So we did a combination of RF microneedling, one treatment. I have a profound machine, and that delivers the result with more downtime, but with fewer treatments. And then a series of sculpture injections on the jawline too at the standard dose for mixing. And as you can see through the years, not only have the injection techniques improved in the products, but also my camera quality. But this was a patient who was sort of going through it. She was going through a divorce, just felt like she was looking like it and was not pleased, but was very reluctant to looking different with injectables and did not want it to be obvious. She owns a pretty big jewelry store down here and wanted an approach that was conservative and measured. So we planned to get some filler in her upper face. She was starting to just lose a lot of volume very quickly and had no structure to hold anything up. And as a result, it was just making her look tired and sort of dead. So the approach was to give her a good lift from the very top, which we were able to do. It took about 6 syringes of Restylane Lift through the cheeks and the temples, very little in the tear troughs, actually. I don't think we did much in the nasolabial fold as well, maybe a little just on the top. And then she did want a half a syringe in her lip to give her just a little bit of a pout. But True story, when we were doing this procedure, and this is why I like to go slowly, because especially first time patients can be very apprehensive. So I like to keep them involved, especially when we plan to do a lot at once, because just the sheer needles and the number of sticks can be very overwhelming. But I knew that she had a desired result and wanted to get her there so she could be a believer. Well, once she bought in, she brought a friend with her, and she had a very anxious moment and wanted us to start to dissolve it because she thought it was going to be too much. So again, just talking her down and explaining that we were going to go slowly was all that we needed to do. But just a reminder to keep that in mind when you're doing work on patients, that on the receiving end, when you're not in this world every day like we are, it can be a very anxiety provoking situation for them. And just make sure that you're checking on them periodically to make sure that they're okay. Of course, she was thrilled when we were done and no longer conservative. Now she flaunts her new face everywhere, and she's very, very happy. But some points to consider there. I also wanted to just make a mention. We have been doing some work down in Alabama on trying to change the focus from syringes and commodifying what we do. Dr. Lupo touched on this a little bit too. It's about the expertise. It's about the fact that you can deliver something that they can't deliver, and that should be rewarded. So we don't really discuss per price. We devise a plan for the patient and then give them a cost, and we generally will build in some sort of discount if they are buying multiple syringes. But when patients know that only you can deliver this result to them, the value suddenly goes up. You don't have those conversations about cost as much because they see the built-in value. And then I find that when you break it down in a way that gives them a number, then they sometimes will try to take control. So if you say, well, I think you need 3 syringes, and they'll come back with, I only want to do 1. Well, we know we're not going to get a good result necessarily all the time with a patient who has a short-term goal in mind. You can kind of gauge it. A good, long-term plan with 1 syringe at a time is fine, but some of these people come in and they have this idea of what they want, and you have to break it down and give it to them in a way that they will be able to understand. So we found that the package pricing and sort of marketing in a way that it's something they can only get at your practice really helps. So that is all that I had to share tonight. If anybody has any questions, I'd be happy to answer them. And I can also be found across most social platforms at Dr. Corey Hartman.
Corey, that was terrific. And thank you so much. You covered it. It's so generational. And I think this is a real pearl. You ended with a real pearl. And I like to ask the faculty, how many people agree with Corey about just giving your services and giving a price and staying away from that, that syringe business? Show of hands. Yeah, I know, right? You guys, if you can take something home from this, this is the thing. Don't get into the syringe game. Don't get into the unit game. You're the one. People come to see you. So I think that's a real GDerm pearl. And Cheryl Clark. Cheryl, do you want to unmute and ask a question? Oh, you have it here. Corey, could you share? This is from Cheryl. Hi, Cheryl. Could you share? Hey, could you share your settings for the profound RF needling?
Yeah, so we keep it right at about 60 all the time. It's actually a pretty user-friendly device that my involvement is minimal. I have an esthetician who is also a laser tech, and she runs it for me. But the settings on that, we push it a little bit, and I can get you more specifics because, again, she knows a little bit more than me. But I'll get you a direct answer. But it's not as variable as you think.
Great. Well, thank you so much. And you'll be on. We're going to have an after party. So after 7, if people want to stay on, we'll be around. And thank you so much. So our next speaker, Mike, before you talk, I've got to ask you the question that I asked everyone, which I know you're going to have a great answer to, which is, this is the anniversary kind of COVID. So what was your biggest practice lesson that you learned during COVID? Could you share that with us?
I think I have lots, I'm sure. I think the biggest thing is I actually started talking to my patients again. I mean, you know, we've all been doing this a long time, and on my, and I do med derm and cosmetic derm, and obviously the cosmetic derm patients I know, the cosmetic patients I know pretty well. The med derm patients sort of just came and went and so forth, but I found myself spending a lot more time getting to know them again. So I think that's been a good thing, and um, I think
Great. That's perfect.
yeah, I think my staff is amazed that I actually will talk to them now. So that's been my change.
That's wonderful. Can we have Dr. Gold's introduction slide? That's so cool. And it's so great to have you. We love you at GDerm, Mike. And everyone, this is Dr. Michael Gold. And he's a dermatologist and cosmetic surgeon, the founder of Gold Skincare Center and Advanced Aesthetics Medical Spa. Dr. Michael Gold is also a clinical assistant professor at Vanderbilt. And a fun fact, you graduated from Meharry Medical School.
I didn't graduate. I teach there.
You taught there. Okay, we've got a Meharry.
I still teach there.
You still, okay, we've got a Meharry connection with Dr. Hartman, who is a graduate, or you're on staff there too?
Graduate.
Graduate, yeah. So there is a Meharry connection. And, Dr. Gold has earned worldwide recognition for leading edge technological advances. And his meeting is wonderful. If you haven't gone to it, you need to go to it. He's the founder of Scale, which is a phenomenal meeting. And he's also president of the 5 Continental Congress, also known as 5CC. So I'm so excited to hear your talk, Michael, and take it from here.
Thanks a lot. Well, I mean, I'm thrilled. I'm thrilled to be here, and I'm just trying to find my PowerPoint here. Let's get this up here. All right, and thank you so much, Wendy, for having me. And I'm sort of I'm thrilled to do this, and hopefully you all will learn something. I will make a comment. I am a member of the Women's Derm Society, Erin. I have been for years. I love that group, and I try to help them where I can help them. So all you presidents, it makes me nervous, but
You're going to get a call from me, so don't you're
anytime. But I also wanted to follow up on Erin's thing. So so the interesting of all the work that Erin's done and Diane has done and several others with the botulinum toxin and rosacea. I've spent the past 3 years working and validating facial scales for microbotox, which are now validated. And the first 20 patients have been enrolled in a clinical trial. Looking at the primary endpoint is actually fine lines in the forehead and cheeks, but that's the primary endpoint, fine lines at rest. And looking at them, primary endpoint 30 days later, but now but the secondary endpoints is everything that you talked about, redness, skin quality, skin tone, and so forth. And so right now that it is in clinicaltrials.gov, and we're in a hold review pattern, and there's 5 of us, and we're going to take that to about 100 patients now. And so you may in a couple of years see an FDA indication for microbotox. We'll see. But so that's it. So Wendy asked me to speak on needles and needling in every generation. And so you will bear with me. This is the first time I'm ever giving this talk. I actually, Nashville had a ice snow event for a week a couple weeks ago, and I decided I was just going to redo a brand new presentation that I've never given before. So you'll all bear with me.
So it's really, really fresh. It's GDermFresh.
It's very fresh. And so again, these are where I work and live, and unfortunately I haven't been to China in over a year now, and I'm missing going there. And I have a lot of disclosures you see there. I work with every one of these companies, and I'm going to share with you hopefully some new novel things that you may or may not know about. So the advent of botulinum toxin has helped spread the rise of everything we do, like no other procedure that we've ever done. And we are all the beneficiaries of this growth in patients that seek both non-invasive or minimally invasive. Even in the COVID era, most of us, even though we shut down a little bit in March, April, May, we've come out very strong. And again, I think that the facial injectables have been one of the leaders in that. And again, we're learning a lot as a result of all this. But every generation has an interest in facial injectables and cosmetic procedures. And I'm going to try to explore the different age groupings, and we'll look at a chart, and then we'll get into some of these things. So some of these slides are borrowed from Bradley Bloom, who many of you know is a millennial dermatologist in New York, and gives some great talks. But again, it gives you an idea of who you are based in the audience, where you fit in. And a lot of us are in the boomer age, and some of you are in the Generation X age, and I'm sure there's some millennials out there, and that's important. So I think that it's when you start looking at this, and you start looking at millennials are a completely different breed. They are a generation that has spent time looking at themselves more than anybody else. They are hyper aware about their appearance, and they start to think about the change of the shape, and again, cosmetic procedures where we used to do them as a way to reverse signs of aging, they look at it to prevent aging. And I think that's good. And again, these are the main areas that have helped do that. Obviously, Zoom and what we've done with that, but FaceTime and Instagram all play a role. And again, skincare to supplements and treatments to what are called tweakments. There's a shift in the beauty and wellness market that is led by this millennial approach. It's guided by both celebrity and social media influence. And again, they're changing, and they have changed a lot, the cosmetic procedure landscape. So if you've never heard of this term tweakments, or not, that's a term now that is being used for non-surgical cosmetics procedures. They're millennials are investing heavily in it. It's sort of akin to the word prejuvenation, where you get discrete results with little downtime. Millennials are keen on skin resurfacing, like lasers and chemical peels. And again, if you look at their numbers, before the pandemic, they went up very high. The interesting thing that I always say is what's going to happen during this post-pandemic, or when we get out of the pandemic, because a lot of them were hurt more financially. But again, most people think that this will be it. And again, if you don't know the term prejuvenation, there's a website on prejuvenation, and again, it's preventing and the process and the perception of aging. So again, prejuvenation is something that again, the young people are looking at very much so. And again, is using Botox and any of the botulinum toxins. Less muscle contractures, less the skin will crease. And again, this is a mainstay in this group. But also other injectables that we have out there we need to consider, and dermal fillers. And again, influencers, the fact that people are doing selfies and looking themselves on Instagram, and especially to me on Zoom, this has been a huge boom for this kind of practice. So I wrote this article a couple of years ago in one of the European medical journal, cosmetic journals, which is a plastics journal. What's new in coming to toxins and stuff. And if you actually study the botulinum toxin market, it is very crowded around the world. We have what we have in red, but there's a lot that are coming, and there are a lot of things that are out there that you need to know about. But again, the red is what we have right now. And we have two more that are prime for approval. You heard about Revance, which is supposedly a longer lasting toxin, and Leta-botulinum toxin A is a botulinum toxin from Hugel, which was originally brought to the US by a company called Chroma, which is in Austria. Hugel's in Korea. Now Hugel controls everything through an agreement with Bain Capital. And if you don't know who runs this, most of you in this audience have heard of Jim Hartman. Jim Hartman is the head of Hugel outside of Korea, and he's bringing all this to the US. So I think what's important to know and what's important to understand for every age is that now the trend is what are the dosing that we need? 20 units of botulinum toxin, or can we use 40, 60, or 80? This was presented a couple months back at the ASDS. Galderma has had dose escalating with Dysport. I've been working with Xeomin, looking at incabotulinum toxin up to 100 units in the glabella, which sounds kind of scary, but if you start looking at just putting charts together, you see the median duration of days when you get into higher doses. And so I think what we're going to see in the future is we're going to see people giving much more botulinum toxin. And again, Revance is coming. It's a different toxin. It has this unique excipient, which again, supposedly is going to make this last a little longer. And again, clinical studies have shown we're going to have approval of this sometime probably in the summer. There's nothing wrong with the drug. There's nothing wrong with the study. The FDA needs to clear the facility in California, and because of COVID, it's been put on delay, but it will come out at some point. And you just have to be prepared that it is coming. Skincare is also very important for this group as well. We spend a small fortune on skincare, and the millennials are obviously part of that group, and they're getting very into personalized skincare. And there's a lot of websites out there that are selling personalized skincare where, again, it's not real personal. You answer questions, they have 3 or 4 things that they mix together and they put it in a box and they send it to you. But again, it's how the millennials are looking at it. So again, when you look at their numbers, they have a huge number. They're very heavy purchasers. They're very heavy in their lifestyle. And again, their spending is going to increase. There's lots of things here about I am a millennial in the middle, and they're tech savvy, they're convenience junkies, they're impatient. Some of them are not, but some are. And again, I think influencers play a very big role in all of this, whether social word of mouth, social media, celebrity status, research driven, price matters. Again, all this plays, and they want it now. And again, I think you have to play your practices and be part of that. They don't see this like we used to see this. They don't see diseases. They see, how am I going to fix? My friend got this, so I want to get it. I don't want to look like my mom. What am I going to do to treat this, and that kind of stuff. So again, when you target these people, sort of make sure that you have your right expectations, definitions, master plan, set up a right treatment. And again, there's lots of different things that you can do with this. We spend a lot of time talking about if you actually treat the younger people early. This was a study that Patrick Bitter did several years ago with the BBL. And you can actually have gene changes to show that if you treat patients, you change their skin and the RNA of their skin. So again, doing these treatments regularly actually help these patients. So that's important as well. So again, but I also like to show people like this because again, based on studies, you would never think that Xeomin could last 6 months. This is actually from the FDA study for Xeomin. This was one of my patients that was put into the public domain. The right patient, the right luck, the right everything, you can get some really nice results. This is a patient, let's see here, sorry. This is one of the study patients from one of the studies. Again, you see here, this is, I think, this is Revance's drug. And again, Revance here. You can fill with the lips, all this stuff the millennials love. And again, there are some really neat products out there that can help these patients and do it. However, know that there are things coming. So many of you probably have never heard of this product called Nuvia. Nuvia is a European filler. US clinical trials will start hopefully sometime in the summer. It's not cross-linked with BDDE. It's cross-linked with something called PEG, which is very important from a legal point of view because there are no patent violations. And it's got actually, this product has, one of their products has a combination of hyaluronic acid and calcium hydroxylapatite. So it's something we're going to be studying and looking at as far as a quick fill and a long time fill on top of that with the calcium hydroxylapatite. What's interesting, this is the women's brand in Europe. And this is the men's brand. There's only 3 products in the men's brand, but marketing is important, and this company does a very good job of it. This is an interesting product that some of you may or may never have heard of. It's an Israeli-based filler company, and again, it's calcium hydroxylapatite and hyaluronic acid in one product. Allergan now owns this company. So in the next year or two, you'll probably see the beginnings of US clinical trials on this. And this is a product called Alginus. If you know who Doug Abel is, Doug Abel runs this company globally. This is a filler which is really just a sugar. Agarose is a sugar, and again, it's been put into fillers, and there's been hundreds of thousands injections with this filler. Very natural, and the millennials like that. And again, something that is going to be FDA cleared hopefully by the end of 2021 or probably early 2022. So again, they don't like to, the millennials have their own way about them, and that's important. So Gen X, these are the mid 60s, born in the mid 60s through 1980. Millennials now outspend Gen X in cosmetic procedures. Boomers still spend a lot of money on cosmetic, but they want it done gracefully and naturally. These are the group born at the end of World War II through the mid 60s. Right now, they're a very influential generation as far as economics. And again, I think if you prepare the patient properly, and you listen to them, and you can age them gracefully and so forth. The silent generation, this was known as the greatest generation. Unfortunately, there are not a lot of them left. My 93-year-old father passed away about 10 days ago or 2 weeks ago. They're leaving us, and again, it's but I did Botox and fillers on my mother until she was about 85. She said she earned it. And so again, it became part of what it was done. And again, the greatest generation is those that were born, that fought in World War II and were born before 28. We don't see them much anymore. But what procedures are we doing in these older patient populations? We're doing everything. We're still doing our toxins and fillers, IPLs, microneedling, and body contouring and fat reduction. So again, I talked about Patrick Bitter's IPL work. And again, this is important kind of work. So how old is this patient and how old is this patient? Well, the interesting thing is that she's older on the right than she is on the left. This patient had a lot of um, broadband light treatments, as did this patient. So again, you do broadband light, you see it's 23 treatments, they look younger. Again, they look younger. And again, this was published in this study, and Patrick Bitter led that. And I showed you this before. Again, RNA changes. Jason Posner and Patrick took this into one step further, and actually treated patients with this. Again, this is Patrick. We all know Patrick. He's had a lot of BBLs. He's probably at about 60 now, but he looks great. And again, this patient we showed. So this is work I did with Dr. Peng Chang, who's a plastic surgeon in China. We actually looked at 2,500 patients that were treated at least 3 times at the beginning, and then at least once a year for the next 7 to 10 years. And we found that their skin improved dramatically, like 90% improvement over time. And so we published that. And again, we have, Corey said his photography got better. This is plastic surgery photography, but look at the difference here. And again, 6 years, 7 years later, the improvements that you get in the skin, just by using IPLs, nothing else but IPLs and skincare. We improved everybody, and I have 2,500 of these patients that we went through, that we actually studied and looked at, to come up with this data. And we published a book in China, which is now sold about 250,000 copies. So I'll end by talking briefly about needling. I put this picture up because I don't know if everybody knows Des Fernandez, who is a plastic surgeon in Cape Town. He's the founder of Environ Skincare, if you know that company. But he was the first one that actually did a needling procedure, with microneedling with rollers, and he did it on himself. And he's popularized that, and so we we have rollers, we have pens that work really well for these procedures. This is another one. And again, I think that these are great procedures to start incorporating into our patients. We get into the radiofrequency parts of this. This is a new device called the Venus Viva MD, where we use microneedling RF pins to improve patients' skin. Again, young and old can be treated this way with minimal downtime. And then we get into the microneedling for the deeper acne scars and rejuvenation. So again, young patient with acne scars, older patient who just wanted a rejuvenation effect. And again, another device with microneedling. And again, you see that crepey skin that you can improve. So I use all these things all the time on my patients to, make them age gracefully. We do a lot of preventative treatments, mainly on the millennials, but we've taken that one step further and we're doing preventative treatments on everybody now. So I hope that helped a little bit. Thank you all.
That was terrific. Thank you so much. I think that, this really is what generational is about, and generational dermatology, aesthetic and medical. So my question to all the faculty is, when would you recommend prejuvenation? At what age? I know that's a very broad question, but I'd like everyone to weigh in on it.
I mean, I think that kids are getting, I say kids, I'm old now. So I mean, I think in their 20s, I'm seeing people in their late teens and early 20s. I had somebody in my office today who was 22 years old, and she just had 4 cyton halo treatments, which is this combination non-ablative ablative laser, and she's like 3 months out and she's not happy. And I'm like, I looked at her skin and it was absolute, there wasn't an imperfection in her skin. And I told my team, we're not going to touch her because there's not much, and so basically I told her skincare is all you need at this point. And then, but I think that the younger patients are coming in their early 20s and they want things. And I think toxins are great for them. And I think a good skincare routine, chemical peels are nice for them. There's something called Clear and Brilliant, which I love to do on young people. So all those things for me work really well.
Great.
Yeah, the young ones in my office, I mean, they're in their 20s and they're doing IPL, they're doing Clear and Brilliant, they're doing Botox, they're doing a little bit of filler. They're certainly doing microneedling. If they have acne, they'll either do Fraxel or radiofrequency microneedling. It really is very individualized. The Diamond Glow is very popular. My African-American patients really like the less aggressive peels and Diamond Glow. And I love my Genesis, the long pulsed 1064, which is totally painless. So, I am the poster child for my patients who are in their 20s and 30s. These are friends of my 2 children, and they all know that I'm going to be 67 this year, and they all know that I've not had, a facelift, and that I've been, it's easier to tell you what I have not done to my face than to tell you what I have done to my face. So it really is. You got to practice what you preach, and you got to preach what you practice.
But I also think it's important what Corey said, and then Wendy went on to, in the millennial population, how many times do people come in and say, you say you want them to get whatever procedure and it costs $500. And they say, well, I went to a spa and they said they could do it for $200. Well, the spa's down the block.
Yeah,
Send them there.
Yeah.
Send it. Okay. Don't trade your expertise because they think they can get a better price somewhere else. You get it because you do the best work and you've earned it. And if they want you, they're going to come back. And when they have a problem, they're going to come back and it's going to be triple.
Right? We can bring it. So we got to know our worth. And speaking of our worth, Yeah,
Does
go ahead.
anyone ask a painter, an artist, how much the paint cost? Has it been done
Well, Mary, nobody even asked the plastic surgeon how much the breast implants cost. I
that?
mean,
Exactly,
so-
exactly. So, but the commoditization has been done primarily by the spas. So because and half the time they're not even ordering legal material.
Right.
Yeah.
I would add one thing, in my practice, I do have some millennials that come in, and I think this is something that I bet a lot of you have had to address. They have come in and they want things done, and I just think that it is just straight up tacky. And I'm just going to say it because they want to have huge lips, or they want to have, enormous amounts of filler. They want to look like Kim Kardashian. And that is just not the style in which I inject. I think also, you also have to have, Michael, you make a good point about sort of like seeing the red flags. And I think that those red flags are really important. But what I'm talking about, is something slightly different, which is you may want a kind of practitioner who can do that for you, but that's not me.
Or
And I
me.
think that's okay, Erin. I think that you assert that, you let them know that, and they'll find somebody else, because just like they want that, you don't want them walking around telling people that you did that to them. So luckily in Alabama, the style and the trend tends away from that. We have people actively saying what they don't want to look like instead of that they want to look like that. And most of them can be easily led in the right direction with a little bit of education. And the ones who don't, they're not your patients. That's fine.
Exactly.
Excellent. Okay. I love it. Great conversation. Save some for the after party. All right. I have a next slide. We're going to acknowledge our sponsor before we have the wonderful Dr. Chamban come. So Underskin. How many people know about Underskin? Anyway, you should. It's a great skincare line. And USK Underskin is a premium skincare brand backed by science from over 100 studies. And I would just want to say, there's no meetings without exhibitors, without our sponsors. So we thank you so much for, believing in GDerm and being our sponsor tonight. The product was founded in Brazil in 2015. And what I love about it, it's medical grade, physician dispensed. So you're not going to be seeing it all over everywhere. It's luxurious, and the technology is really forward. The product has been developed in laboratories worldwide, all the places where Dr. Gold is traveling to, and especially in Italy. And the mission of Underskin is to introduce these innovative products and technology to physicians around the United States. And in our box this month, you have some wonderful Underskin products. So my favorite is the Hydro Glow Bomb. So I just want to again say thank you so much. I'll take our next slide, our next introduction slide. I'm so excited. She is one of our GDerm All-Stars, and Dr. Ava Chamban is a board certified dermatologist and owner of the Laser Institute for Dermatology, European Skincare in Santa Monica, and the Ava MD Med Spa in Beverly Hills. She's internationally recognized. She's an American celebrity dermatologist and was the featured dermatologist on Extreme Makeovers, and has had so many more numerous appearances on television and cosmetic publications. She's an authority on the subject. One of the things I love about Dr. Chamban's practice is she's very involved with patient self-esteem. And she is an expert on self-esteem. And as I said earlier, please go and order the box by Dr. Ava. It's her newest innovation. Great to have you here, Ava.
Thank you so much, Wendy, for inviting me. Okay, let's see if I can share the screen. Let's see. Share. Yes.
Oh.
All right, let me just put it into, so I can do a slideshow. Hold on. I have technical support here. Brian. I just want to do it as a slideshow. Oh, here it is. Never mind. I found it. There we go. Come on. Here we go. Okay. Here we go. All right. So my job tonight is to really discuss how to combine skincare with microneedling, with injectables. I really love that data that Patrick Bitter did, and all of the prior speakers have really excellent presentations, and I learned something from all of you. And I think that, you know, the name of the game is combination. So with that being said, Brian, my sound isn't working.
You know, we were all staring at it anyway, Ava, but.
Oh, no, this is like, I'm going to run it one more time. How come my sound?
So your microphone's working, but not
Yeah.
this.
Hold on, here's my tech
If you
support.
take your headphones out, we may be able to hear your sound better.
Okay, I'll take my headphones out.
Very good, Christy DiBernardo.
We can just do the sound.
You may have to reshare with the sound checkbox when you hit share screen.
Okay, so what does the Great British Bake Off have to do with dermatology? So some of the similarities are there's a wide range of ingredients, and this is sort of short list: flour, eggs, sugar, vanilla, spices. The end product needs to be beautiful. It is an art and a science. What are some of the differences? Well, we have actual ingredients: laser, filler, toxin, and skincare. We are working versus the baking is a cupcake. We're working on the face or the body. It's not a competition. Those are some of the differences. So what's the rationale for my metaphor? So the rationale really is that if you leave out one of the ingredients when baking, your end product is completely compromised. And so by the same token, if you leave out one ingredient in your treatment plan, your end product or your end result is suboptimal. So, so take that and chew it. Anyway, and if you haven't seen the British Baking Show, it's absolutely fantastic. So what is the new understanding of the physiology of aging? Well, I love the Patrick Bitter work, but there's also some interesting data on senescent cells. And I haven't seen this much information about this recently, but basically senescent cells seem to secrete some kind of a protein that accelerates aging. And when you block that release, then mice live longer. And I saw this data a while ago, and I haven't seen what they have done with it lately. So there's senescent cells. There's also, we know a lot about telomeres and how the longer the telomeres are, the longer you have, and how important it is to maintain the length of these telomere sequences. And of course, the woman who discovered this is PhD Dr. Elizabeth Blackburn, and she spoke at the AAD, talks about how to maintain the activity of telomerase. And of course, it's all the usual suspects. It's good nutrition, it's good sleep habits, sun avoidance, reduced stress. So we also, very interestingly enough, there has been some data showing that when you exercise, and even a short-term aerobic exercise program does increase tissue mitochondria. And you see in skin biopsies that the stratum corneum gets thicker as the entire dermis. There's increased collagen content as well. So this is, I thought, very interesting data. And this is also, that was with sort of short-term acute exercise, and this is with chronic exercise as well. And this is associated with attenuated aging in human skin and greater mitochondrial content. So this work was done, I'm trying to see what the ages are, but it was compared to 39-year-old individuals. So this has been gone over, in terms of facial aging, there's deterioration in terms of bony loss. And so it was like when I discussed this with patients that actually your foundation and your framework is really shrinking. There's deflation and descent of the fat pads. And so, and there's also, this creates some of the disproportion that you see looking at the jawline here versus here and here. So I wasn't going to include this slide because I think you've all seen it, but my staff was like, no, you have to show it, because then everybody starts touching their face. But if you look at these two skulls from these two different generations, you can really see the atrophy of the bone and why you lose that sharp detailed of the posterior mandible angle, and also why the wrinkles really form, because some of the wrinkles that form around the mouth really have to do with bony loss, not just with hyperactivity of the muscle, fat, and collagen loss, but the bone. Look at the changes in the bone. So, we know that there are static wrinkles. This woman is, 35 years old, not really, but, this is obviously from cumulative sun damage. And the sun, by the way, increases the production of IL-8, and which also chews up fat. So it's not just cutaneous. You can see some of these other creatures that have wrinkles. Dynamic wrinkles are obviously caused by muscular movement. And this is why treating patients at a younger age with a neuromodulator can help prevent these wrinkles from forming. And so in addition to Bitter's work, I think the twin study, and I don't think Michael showed that slide, where they talk about having botulinum toxin at an earlier age just literally changes the way that you age. And maybe Aaron Gilbert can weigh in on this, because it definitely has a physiological effect. Okay, so what's the plan? What's our action plan? So what we want to do is definitely a whole series of treatments, and it's a constant maintenance. It's like making sure that your hair looks, taking care of your hair and your teeth. And everybody has started to understand that, in particular the millennials, because they're all about reading what's going on, because if anybody wants to stay fixed in time, it's the millennials. So we know that it's important to have a series, and that doesn't just mean like we're going to do a series of 6 and say that, okay, you're done, that's it, goodbye. It's like, okay, series of treatments, series means over time. We want to use a combination of different modalities, whether it's a combination of lasers and fillers and toxins and focused ultrasound and microneedling and peels. And then if you are the only point of contact for the patient, when they come in, or your office, they come in and have a treatment at the office, and then they go home and they, don't do anything. It's the same as if you're going to the dentist and you're not going to brush your teeth. So what's important? Skincare, skincare, skincare. And that's the magic ingredient. Concierge service is also very important. And I think one upside to the pandemic has been that we've learned the power of telemedicine, and also I call it teleaesthetics, so that you can be in contact with your patients without having to have them cross your door. You can just schedule a phone call with one of your staff and see how they're doing and how they're reacting to their skincare, and if they're actually maintaining it. So what are some of the issues? So we know that people can have browns. I'm just making this sort of dumb it down for all of you intellectuals out there. Brown spots, red spots, fine lines, deep wrinkles, folds, tissue laxity. And so, I'm going to talk a little bit about microneedling, because this is something that's extremely popular now. So it is considered to be percutaneous collagen induction therapy. And so the rows of these fine needles will create these microchannels in the skin that have negligible epidermal injury. And so you can use it for all different kinds of different kinds of problems in the skin. So in particular, of course, acne scarring, fine lines and wrinkles, textural changes. And when we like to also use it with it's not just me calling it, but laser assisted or just microneedling assisted drug delivery. So since you're puncturing a little hole in the epidermis, then you not only are stimulating this cascade of inflammatory events and release of cytokines by the cells, but you're also allowing the penetration of different active ingredients. It's just important that anything that you put on top of the skin is approved for that use. So we know now from doing microarray studies that there is a release of all of these various growth factors, and that's from wounding, and that a fibroconnection network does form, which creates a matrix where the first type of collagen that's laid down with wound healing, which is type 3, which is then replaced by type 1 collagen. And Cheryl Clark, I don't know if she's still on this, but I'm trying to remember the ratio, but maybe it's 70% type 1 and 25% type 3, and then all the other ones are very minor amounts. So some of the indications for microneedling, I talked about that it stimulates collagen production and also remodeling. It also stimulates angiogenesis, promotes wound healing. And so we can treat scars, acne scars, atrophic scars, hypertrophic scars, burn scars, wrinkles, and deep lines. It also can be used, sort of for cellulite and stretch marks. But once again, this is a procedure for microneedling that's done best in combination with cellulite. Different dermatoses such as acne and alopecia, and that's more for delivery. So it's important to know that whatever device you're using, that it does have FDA approval, because some of them do not. We also, in my office, we use a lot of the microneedling with radio frequency, and the insulated needles allow you to treat skin of color. The non-insulated microneedle, because you're heating all the way down, you can end up with a thermal injury. But adding a little heat there can give you a little bit more tissue tightening. So I'm just going to show you a couple of these pictures before I get to the skincare, but you can see the kind of wounding that you get, and that it's not a single pass. You can, and this is an opportunity for people to determine how much downtime the patient has, whether you do a single pass, several passes, to get to an endpoint. But it's a nice controlled injury. So in terms of injectables, this is just kind of a short list, and these have all been discussed. The toxins, these are not even the 4 that are currently available. These are just sort of, I call this the first generation of these toxins, the Dysport, Botox, and Xeomin. And then injection areas. I mean, one thing that we've learned over the years is that you can pretty much inject anywhere on the face. Obviously, some areas are riskier than others, but this isn't a complication talk, but pretty much you can add contour, which I like contour in the face, to really just anywhere in the face. I'm just seeing if I have, this is just an example of a technique. Okay, so looking at Marie's face, she's really gorgeous. And she's got like really big eyes and big, beautiful lips too. And she's just entering the woo-woo land, premature aging. So she's 40. So, hello, 40. We're going to reverse a few changes that I'm starting to see, as well as support the face so that she goes into this next decade looking even better than she did before. The product I'm going to use is called RH3, and it occurs in 3 forms, 2, 3, 4. And what's different about it, the sugars that are the product are made much more similarly to what is actually in our skin. So we're going to see that it moves very nicely with the skin and also contours in a beautiful fashion. Okay, so I'm going to use a cannula. So I'm just going to make a little entry point here. Try and, did that help with the pain? Yes, not really. I don't feel it at all, actually. So it's really nice. It just makes a little entry point. It feels a little funky. I'm using a 25 gauge cannula. What's nice about this technique is we can go all the way up under the eye. It shouldn't really hurt. It should just feel a little funky. And then just place a little bit of product there. So even in a beautiful 40-year-old, I can see that her future is that she's going to be skeletal. And so I want to just give her a little bit of a lift, nothing obvious, but just kind of take it back to where she was like 30. And you can see this is a two-handed technique. And this is a two-handed procedure, really. And I'm feeling exactly what level I'm in. You can see me popping through into the deeper fat pad. Just a little bit more contour here.
Ava, what products do you like in this area?
No, I like Restylane Define here. This is the resilient hyaluronic acid, the teoxane product. That's RHA3. Where we demonstrate. But you can see the difference between the right and the left. Okay. I'm going to show a thread injection because this is just talking about all of our toolkit here. But also Voluma you can use deep in the mid face. Restylane Lift.
No, it doesn't hurt. I'll let you know.
All my patients have been drugged.
Squelchy. She's slightly impolite.
So this is sort of showing a, what I call the cross the heart. This is a video thread. Is someone asking me a question?
I would try.
Larissa?
Not having any choice.
Just like a
Take a
crotch.
look and you'll see why.
See, I'm coming right across here.
With a pout face. So I spread the dreary weary all over the place.
Larissa?
This lasts for about 6 months, and then you do a second, and then
A log
Okay.
comes to an octopus with his 8 great arms, covered on the underside with tiny sucker charms.
Is somebody talking? I mean, it sounds like Larissa Stewart is talking. Okay. So anyway, so
Hi, everyone. Can you mute?
yeah, so it's fine lines and wrinkles, and some of the tools we use for that are fractional lasers, sometimes ablative lasers, although I'm not doing that very often anymore, and non-ablative lasers, obviously. And so, you know, this I don't want to go over too much because I want to get to my skincare part of this talk, which we're just starting now. So in terms of the types of cosmeceuticals, the list has really increased. But in general, the categories are antioxidants, anti-inflammatories, and of course, oftentimes the actives are both antioxidant and anti-inflammatory. Alpha hydroxyacids, these are an oldie but goodie, and I did a lot of the original work with Howard Murad on alpha hydroxyacids. They not only are an excellent exfoliant, but they also stimulate the production of GAGs by the skin, which is why they give a plumping effect. Retinoids, that data has been around for 30 years. Peptides are sort of newer, and botanicals often act as antioxidants and anti-inflammatories. Vitamins as well can act as antioxidants. Niacinamide is an excellent anti-inflammatory, as well as good for acne. Vitamin C, we all know that can increase collagen production. Trace metals can be antiseptic and different moisturizers, and then finally probiotics, growth factors. So you can understand that this is at all confusing to any of us. This can be overwhelming to the patients. Stem cells, we know that stem cells are like trying to drive a truck through a needle hole. So they're generally fragments unless they're being injected through some kind of poration. So I want to talk specifically about underskin because I have found that this particular line is outstanding in terms of how the skin reacts to it. We're using it quite a bit in my offices. And Wendy, you have an old bio on me because my practices are now called Ava MD. But it has a lot of different elements in this line. And as Wendy discussed in the opening slide, they've done a tremendous amount of research looking at the efficacy of treatment with the line. So it was founded in Brazil, but it was developed beginning in 2011, and it's pharmaceutical grade. Obviously, it is not a pharmaceutical, it's a cosmeceutical, but it is exceptionally high performance skincare, and the ingredients are patented. So there have been 110 product studies, and the studies have been done by Monti Research in Milan. So in terms of what are the most important ingredients, it's really growth factors and peptides, as well as retinoids and alpha hydroxyacids. There's SPF, there's antioxidants, and there's DNA repair enzymes. And so if you would go back to that list that I just had of all of the different active ingredients, you can see that this line hits on most of them. So what I find really interesting about the thoughtfulness behind the development of this line is that there's an understanding of a pyramid design of the skincare. So you know that the fundamentals obviously are SPF all day long and night long, especially if you're with the land of never sunset. Antioxidants, and then DNA enzymes to help repair. Then in terms of really making of also, so those are the fundamentals, and then transformation, you want to have ingredients that are going to moisturize, exfoliate, and also help stimulate cell renewal and division. And then finally, the optimization of the skincare comes through growth factors and peptides. And those are stimulatory as well. So one of the products that we sell quite well is the cleaning and toning, the Perfect Balance Toner. And what's nice about it is it's purifying. It does show some pore tightening. It has a very nice astringent effect, and it does help control oil production and excessive shine. So, so sometimes people have drier skin, but their pores are big. So I'll use it for them, even if they're not that oily. But then because it cleanses, and then I can replace I can replace the moisturizer with another product from the line. So it can be used in combination skin, oily skin, and so-called congested skin, which we see a lot of in our high pollutant area. Because it has a very low alcohol content in the composition, only 5%, sometimes I'll even use it for people that have very dry skin. So what does the Balance Toner do? It also helps decrease 5-alpha reductase. And so this helps with sebum control and regulation, because we know that a lot of these little oil glands are just tiny little, they're affected by high testosterone content. And so we see oiliness in, hormonal acne, and also obviously in teenagers. And so this is a nice product that I use in teenagers along with their acne product. So for the elixir, for the Pearl and Caviar elixir, this is a wonderful product because it does brightening, and it helps with skin density, and it helps improve pores as well. So the so-called cellular renewal, the skin food, these restoring vitamins, minerals, proteins, and lipids are helpful. And you also get a little bit of a lightening action from the product. So there is the pearl and caviar extract, as well as epidermal growth factor and polysaccharides. And so the pearl and caviar, these are really, so when I said at the beginning, that's why I thought I would get your attention with the British Baking Show, is that you want to be able to combine all of these treatments with skincare that's actually going to do something. So the next one is the revitalizing growth factor. And so the revitalizing growth factor, which is in the Young Glow Balm, it's obtained from, it's recombinant technology. And so you get some, I think it's RNA that's inoculated into the E. coli. And so then you get the final protein, you get the final product, which is a peptide, a growth factor, and then it's nano-coated so that it is able to enter into the skin. So this Desire Sculpt Serum, this is like our most popular product in the Beverly Hills office, because of the combination of actives that you can, when it says volume here, it really means that the skin is plumper. You're obviously not going to get, it's not like a filler, but you're going to have plumper skin. And there's a wrinkle reduction and an excellent way to moisturize the skin. And so Densyl Repair is their kind of combination molecule that they have. And it's an active ingredient that helps provide action, that helps stimulate the thickness of the dermis, and it gives a restorative effect as well. So the Desire Sculpt Serum has another complex called the Tensile Tech, complex. And so what I found is, especially with this line, is a lot of lines will sort of develop kind of their key compound, which is where they bundle together a lot of different actives. But I found that with Underskin, that these complexes tend to you really see a difference in the skin. So with this set of active ingredients, you can start to see a mild lifting effect with some actual tightening, which will help decrease the appearance of wrinkles, fine lines, and some expression lines. So this is made of flaxseed, neuroprotective peptides, and also some essential amino acids, all developed with a cross-linking polymer technology, so that you really get some penetration. So you do start to see some lift. And so that's why I say you want to combine this with office procedures. So some of the active ingredients are ornithine, phospholipids, and glycolipids. And so this helps by activating the hypoxia-inducing factor, which is something that I hadn't heard of before. But when you start to look at these slides of what's actually going on in the skin, you're like, oh my God. But there's a lot of different a lot of different points where you can intervene with whether we're doing something in the office or even with skincare. So this factor, this HIF-1 alpha factor, is a transcription factor and plays an important role in the regulation of angiogenesis in response to hypoxia. So we've already mentioned the active ingredients. And so what you can see is that it seems to help reverse the lipoatrophy process. And so, as I said, that can be related both to age and also to the exposure of cumulative exposure to ultraviolet light, because ultraviolet light, as I mentioned, does increase the production of IL-6, which chews up the fat. And so you can see the before and afters, and there was a study that was done. And here in these pictures, you can see that there is some diminution of this nasolabial fold, but I think that's what's really impressive too, is the improvement in the size of the pores. And so in this study with 20 volunteers, the product was applied twice a day, and the cream has 2% of the active. And so the pictures showed a reduction of 27 to 37% of roughness and the depth of the wrinkle. But you can really see from the before and after on this cheek picture. So these active ingredients are helpful also in the neck. So the aminopropane sulfonic acid with the calcium hydroxymethionine can help improve the quality of the skin here, giving it some tightening effect and some improvement in the depth of these lines. So once again, it's okay on its own, but you combine it with a procedure, then I really feel that active skincare, it's where you really see that the sum of the parts, the whole is greater than the sum of its parts, essentially. So I think that's really impressive. Now, in terms of helping, I talked a little bit about the ends of the caps to the telomeres, which are like the caps to the end of your shoelaces, if anybody wears shoelaces anymore, that you want to really protect these ends of the telomeres. And so if you have some telomere protection, then you can help literally slow down aging, which is what this whole meeting is about. And I like to say changing the way you age. So the Glow Balm, and this is the last product that I'm going to talk about, this is an anti-aging moisturizer, and this has hexapeptides that protect the skin from oxidative stress and also help to preserve collagen and elastin to reduce and retard the effects of aging and sun exposure and ultraviolet damage. So you might be able to get some enhancement of cellular lifespan, but it definitely improves moisture and luminosity. And it also absolutely helps protect cellular DNA from oxidative stress, it reduces the activity of the metalloproteinases. So you help prevent degradation of existing collagen and elastin while stimulating some fibroblasts to produce new collagen and new elastin. And so you get an increased dermal density because you have fibroblast proliferation, which will, of course, increase their collagen production when stimulated. And this is what it looks like. So in the studies, it showed an 89% improvement in hydration and smoothness, 70% improvement in luminosity, 6.7% increase in firmness, and 22% decrease in DNA damage after UV exposure. And so these tests are very easy to do now, considering that we are able to do these microarray. So in terms of how do you use it, you use 1 to 2 pumps once or twice a day. And this is where your follow-up visit with teleaesthetics really works. And you apply it following any serums and prior to leave on cream masks. Okay, so how does it really protect against UV irradiation? And the cultures, so in this technique, there was a fibroblast culture, which I did back in the day. And the fibroblasts were irradiated and incubated with a product in trial. And so what it showed was that there was a decrease of 22% of the DNA damage from the ultraviolet in these tissue culture fibroblasts. And so that's that's very impressive for a balm. So In some, all procedures need to be combined with skincare. And these are my various websites, and my Twitter handle is at Dr. Ava Says. And then I'm one of the co-hosts on the gist.live. So thank you very much.
Thank you, Ava. That was wonderful. We've got some questions. So I want to get the question from Denise. And this is great for everyone on. Please discuss the essential needling device for a new practice. For example, microneedling pen versus an aqua gold system. That's the question. Lupo.
So aqua gold, that little device, is extremely priced. You can get something called a hydra needle that can deliver your combination of toxin, which is how I do facial flushing with a neuromodulator, to make sure that it stays like in the upper papillary dermis. I just get little micro bleeding points, and I usually put in a little hyper blended HA in my combination. Wendy, you were at boot camp probably in 2015 when I demonstrated that stamping technique.
Oh yeah, that's great.
But I think the essential things when you start a practice are to get very good at the things that you will get low cost in and high return of investment. So, do very well with your neuromodulators, your injectables. Do chemical peels. Chemical peels, your cost of chemical peels is so low compared to buying an expensive device. And there's still a place for peels in your practice. I still do them, even though I have about 12 to 15 devices that I actively use in my practice, and I probably have 4 or 5 that are just gathering dust. So peels are very important. Sclerotherapy is another one that I think is very important. Things that you do with needles. The first devices to buy, I really think that depends on your patient demographic. Here in New Orleans, the Fraxel is a big plus for me because of the way that I can use it on my diverse skin population. You don't want to get an IPL if you have a large 4, 5, and 6, and you don't have a lower number. So you got to know your patient's needs and speak to that. So if you have a very young population, well, then you might want a Clear and Brilliant device. If you're medical, but you do some cosmetic, I think the XLV, because you can treat your rosacea, you can treat scarring, you can treat your blue veins, periorbital veins with it. You can do the Laser Genesis series for low-level rejuvenation in your millennial patients without any pain or downtime. So you really need to know, what is your practice? Who are your patients? What is the demographic, both skin type wise, as well as age wise?
Great. Thank you, Mary. Ava, there is a question. Hi, Adrienne Stewart. How you doing? She wants to know, I think you said them, but you want to talk about your favorite underskin products? What were your
For me?
Yes, just for you.
Yeah, well, I mean, as I said, I love them all. I would say that I love this Desire Sculpt Serum. I mean, it's hard to pick. It's like, which is your favorite child, because you can use them, you just use them for different needs. But I mean, I really love using the toner, and I love the Desire Sculpt Serum because I want everything to go up. But the Young Glow Balm is outstanding.
Oh, that's my favorite.
Yeah, I think that's really good. And, yeah, I mean, it's hard to choose, but they're good.
The cleaner, there's a 2-in-1, the cleaner toner.
Yeah.
Right, the 2-in-1 for the, no one with time, the young mom. So, well, guys, it's time to say goodbye. It's been wonderful. And Ava, Corey, Michael, Mary, Erin. And there's a slide, I don't know, Pat, if you can put it up, but we'll be here, 4th episode, April 6th, 2021. Dr. Kimberly Butterwick and Ellen Gendler are going to talk about facial anatomy of aging. and like mother, like daughter, AKA mom jeans.
Mom.
So this is,
That's good.
it's all happening here in Generational Dermatology. And thank you, everybody. Be safe.
Bye.
Thank you, Wendy. It's fantastic. Thank you.
And see you all.
Bye, everybody. Thank you, everyone, for joining.
Thank
Feel free
you.
to contact, feel free to contact any of us.
Yep.
Bye.
I love that. Great. We're here. Actually, we're
So
here.
much.
We're still here, Ava.
What?
I said, we're still here. This is the after party.
Oh, is this the after party?
Yeah.
That was so great. Thank you, Dr. Ava. This is Christina. I'm here with all your amazing employees.
Oh, thank you.
And thank you, Dr. Roberts. Yeah, it was so great.
Did you like the baking show?
I loved it. I was so excited to see what you were going to talk about.
Well, Wendy, do you think I made my point?
Oh,
I thought it was awesome.
It was great. You're just direct and you just gave it. You made your point. Yeah, point made.
Exactly.
I had fun with that.
Oh, you know what? I don't know if people are still on, but everybody. Okay, good. Everyone, the box has full-size products. So
Use them.
Hi,
Cheryl.
Use them.
Yes, hi.
Hi, it's my roomie. Where's Guy? Guy Zanelli, where did he go? Did he check out?
Was he in?
He was in.
He came in and checked out. That's good.
Can you hear me?
On my texting.
Yeah. Hi, Diane.
Ava, do you or Wendy know if the line has preservatives that are going to be friendly to the millennial mindset?
No, that's a good question.
You know, they want
Ava,
all
I love the baking
natural.
show.
You love the thank you, Diane.
Yeah,
Wait,
I
no,
think it's a pretty clean line, actually.
Yeah, it's clean.
Yeah, it's
Clean and green.
I think millennials.
So how does it compare to Definage?
Pass the millennial test.
How does it compare to Definage and Photozyme lines?
I think a little different. Just like
Definage creates new stem cells
Yeah.
in the basal cell layer.
It's a little
I mean, it
different
takes the stem
mechanism.
cells and converts them into basal cell keratinocytes. So they're brand new and fresh and undamaged genetically. None of these products do
Isn't
that.
it like a DNA repair, Photozyme and Definage?
Yeah, Photozyme has the
DNA
DNA
repair.
repair. Yeah.
I need it all.
Yeah, I mean, do we put like 100 products on our face every day? What do we do?
Yeah, 200 things on our face.
Gotta rotate. And I think your skin tells you. You rotate your
I think you have
products
to rotate. You
and
totally.
your skin kind of lets you know what it's loving.
Yeah, I'm making
I
my
treat it like fragrance. I just do what strikes me on that particular day.
Yes, and the underskin products, the fragrance is natural. It's black cherry and peony, and it has an
Yummy.
anti-inflammatory effect,
Yummy.
an antioxidant. Yeah.
So, like, I think everyone should do Definage at least once, and then they can turn over these great cells and then start these other products.
Yes, and underskin also builds new skin cells as well. So you combine growth factors, peptides, patented formulations. So you can definitely layer as many products as you want to.
What if somebody has actinic keratosis? Should they be using that line?
Yes, actually, our Hydra acids is really good for that as well.
But is it going to turn over those actinic keratosis cells and proliferate them?
Is our science girl on, like, Christy? Can you answer that question just to be sure? I don't know if Christy DiBernardo's on the call.
She was.
She
She
was.
was. I don't see her.
Yeah, I can get a definitive answer to that for you, though. I'll definitely send it to Dr. Roberts. Yes, for sure.
Yeah, we'll
I'd
put
like to know too.
We'll put everything up on the website. So all the
Great.
contacts and follow-up information that, will all be there. Okay.
Great.
Just give us like 24 hours.
I just signed up online to get samples.
Oh, you did? They're trade
Oh, yeah.
sizes. They're trades. They're actually big sizes of great products.
Awesome.
Oh, that's good. I'm glad you signed up. Great.
All right, everybody. I have to sign off.
Bedtime.
Thank you.
Ready
Thanks,
dinner.
Ava.
Thank you.
Bye.
That's
Bye,
great.
everyone.
Great
Thank you,
job,
Dr.
everyone.
Eva.
Thank you.
Oh, you're so welcome.
Bye.
Bye.
Love you.
Love
Love
you.
Love
you.
you. Love you.
Thank you.
Nice to see everybody. Bye, Eva. Bye, Diane.
Bye,
Bye,
Ava.
Christina.
Diane, is
Diane.
Diane on?
See you soon.
Hey, Di, you still on?
No, I think she checked. I think she's gone.
Okay. Yeah, then
Shirley's
New Yorkers,
dog in
we
the
gotta
background.
Thank